That's all right. I'll start over. Good evening, everyone, and welcome to this regular meeting of the Dunn County Health and Human Services Board for Thursday, September 28th, here in room 54 of the Government Center. Let the record show that all members are present with the exception of Mr. Lamb, and we'll make sure to record him if he joins us later by Zoom. We have two sets of minutes to approve: our last meeting of August 24th and the public hearing also on August 24th. Acceptable for a single motion on both sets, I think. So I would like a motion to approve both sets of minutes. Supervisor Hagan, is there a second? Supervisor Steen, any additions or corrections? Additions or corrections? If not, all in favor of approving the minutes, say aye.
Aye.
Aye. Any opposed? Minutes. Let the record show that Dr. Hall is abstaining. I should have passed those over to technological problems. Okay. We do have a public comment. Ms. Winter, will you read that for us?
Yes. This is from Terry Nichols. Hello, Health and Human Services Board. After reading your agenda and associated materials, you guys rock. The year 2019 was the year of groundwater per Governor Evers, yet I'm not seeing much progress addressing the groundwater problems in the state. My father used to say talk is cheap. It's too bad that the DNR doesn't post the number of residents on bottled water in this state. The city of La Crosse would be a good place to start with their PFAS problem. The DNR will tell you that you need to test your water once a year for bacteria and nitrates if you live in a rural area and have your own well and septic system. There are municipal wells across the state that are shut down due to the PFA crisis. The city of Rhinelander has one shut down. Madison is another. Wouldn't it be nice if Dunn County's workers that are on the front lines taking care of Dunn County rural residents check to see when their well has been tested last? Or maybe you're ahead of me already. Great work, all involved. Harry Nichols, Town of Colfax.
And thank you, Mr. Nichols. And in fact, we will be talking briefly about water testing. So there we go. Next meeting date, October 26th, regular schedule, Thursday, 6 p.m. Okay with everyone? All right, moving on. It is that time of year when standing committees are asked to look at items they wish the legislature to consider on our behalf. I included in your packet the legislative agenda that we submitted for last year. I don't know how far we can get on this today, but I thought if we walked through each item, not in great detail, but if we walked through each of the items listed, we could at least say if it should be in for this round or not. And there may be some specific changes that the staff will need to make based on changes that have occurred in the last year. I didn't reach out to the staff before I included this, which is probably something that I should have done, but I didn't. So with no objection, first item reads, while the 30 million in recent general revenue increases were helpful to counties to maintain child welfare services, the CFA increases have not covered the increased cost of child welfare services. Hence the recommendation to increase the children and families allocation up to 20 million or a 20% increase. Paula and Becky, I don't know if we want to leave that in. I would assume that we do. I think it is still pertinent. I just don't know if the numbers specifically are still valid.
We can check on that and then get back to you next month, but it certainly would, we would assume by where we're currently at that would need to be continued. Perfect. In there.
All right. Any concerns from members of the committee? All right, that stays in, and we'll amend the numbers if we need it. My hunch is this one stays in as well. Increase funding to aging and disability resource centers in the amount of $32 million to reduce historical inequities in funding, to keep pace with expanding needs, and to allow full funding of mandated services. Does the money still work, or do we want to ask for more?
I would have to research that piece of it because that's a state
Yeah,
response and not just ours. So
Yeah.
I would have to research the money piece of it, but assuming we would still need an increase.
Yep.
Based on Dunn County's data.
absolutely. And the number of increases in services provided in ADRC. Any objection to keeping ADRC here on our wish list? All right, moving on. Provide a $4 million increase in the birth to 3 state GPR allocation and provide annual GPR increases to cover the growth in caseload and service costs. Any concerns about keeping this in? Birth to 3 is woefully underfunded. And we do have a play group here tonight. So if you hear little squeakies, it's because the children are benefiting from birth to 3. D, continued support for Medicaid expansion in Wisconsin by accepting $1.6 million in federal support to increase healthcare options and services. Accepting Medicaid. Leave it in?
Yeah.
I think so. All right, good. E, the public mental health system in Wisconsin is in need of additional resources to respond appropriately to the needs of individuals experiencing a mental health crisis. Counties do not have the tax levy capacity to fund sufficient crisis intervention services to meet the need. Goodness, we've got 2 periods in there. Provide additional state GPR. I think we need to edit that sentence too. Provide additional state GPR to fully fund crisis intervention services statewide. We'll clean that one up if it stays in. Dr. Hall?
I mean, so I have a question for Ms. Winters. I would imagine that this is still the case, that we're still struggling to respond to those things. I also wonder to what extent we also do not have capacity to meet the needs of people for ongoing routine mental health care, right? I don't get the sense that it's just crisis that is kind of exceeding our capacity. You could speak to that.
That is correct. In addition to this, the CSP program, we've been asking for that program to be fully funded, and that's the people with our chronic and most persistent mental health issues. And we continue to not have that funded fully. And so we would like that to be funded just like the CCS program is, and would request that that be added to this additional.
No objection from me. Any objection from other members? Concerns? Thank you for raising that, Dr. Hall. So do we also then need to add another item about responding to ongoing mental health needs? All right. Again, any objection? All right, good. Moving on to F, increase Medicaid reimbursement rates for mental health providers. I assume that that is still in play. All right, any objection? Moving to the Health Department, preserve the statutory authority of public health agencies for control of communicable diseases and public health threats. Still in play, I think. Any concerns? Tweaks? All right. H, advocate for wait a minute. Wait a minute, I've just done something to my screen. Hang on, I'll find it back. I'll get it back. Dr. Hall, you want to take this till I get my screen back up?
Sure. Do you want me to just give you this?
Oh, sure. Oh, no, I found it. It's there. All right. H, advocate for expanded funding for county public health department staffing for communicable disease investigations and to continue to follow up cases of COVID-19. Go ahead, KT, please.
So I would share that the communicable disease follow-up is still a necessary need. We have discontinued substantively the majority of our COVID-19 follow-up, so we could strike that
Okay, strike the whole item.
Well, strike the COVID-19 component.
Strike the COVID-19. Okay, that makes sense.
If you guys are comfortable with that.
It makes sense to me, members. Okay. I provide at least $36 million in funding to support public health infrastructure in the state, with half of the funding allocated to local public health agencies, again, to support communicable disease investigation and mitigation. That still stands? Yes, Dr. Hall.
So given this item, which has the piece in it about supporting communicable disease investigation and mitigation, I think then we can strike H in its entirety because it's redundant. But yeah, it would be nice if our public health funding were more on par with the rest of the states in our country. That would be helpful. Yeah.
Got that? All right, Jay, advocate for a state groundwater assessment and monitoring initiative. Additionally, fund mitigation of problems that are identified in groundwater quality and secure funding for long-term private drinking water protection, monitoring, and remediation programs. Still good, still obviously a significant need. I don't know where we stand on this one. This is one of those that came out of the year of water. Okay, request that DNR establish standards for PFAS levels and monitoring methods and provide appropriate responses to PFAS contamination in drinking water, groundwater, and surface water. Yes, Supervisor Hagan.
Pardon me, sorry. At the Wisconsin Counties Association, they did talk about PFAS levels, and they are bringing the acceptable levels down to like almost nothing, like 4 parts per trillion or so from what the current standards are. So I believe K is currently, from my knowledge, K is happening. Does that sound accurate?
I would defer to KT.
So I can double check just to be sure, but I think that there is some movement on the federal level. And so there is kind of this holding pattern about amending it to establish standards. So I think it is still in play, but again, I can get back to you.
Okay, let us know what you think you want to do with this one. Greg, this is up to you, these last two. Support increased County Veteran Services Officer grant funds to mitigate the impacts of static funding for well over 10 years. We got a little burst, but I suspect this still stands.
Yeah, I think we should support some type of formulary increase based upon other actions and how they approach funding at the state, and so I'll kind of leave that open for discussion.
Would you be willing to draft some language to that effect?
Yeah, I'm sure there's some other model programs that have kind of a statutorial increase, like a COLA or a,
yeah.
I think they're changing the terms now to like I don't know, underfunded something, but yeah, definitely.
Okay.
The second one on the national or federal level, there is legislation supported by Tammy Baldwin called the CVSO Act that has gotten some traction, and so I think just definitely, I know this is on the state level, but it actually could help take some burden off of local funding.
So
yeah.
that's a keeper.
Correct. Yep.
Any concerns about either of these two items? One being slightly amended by Greg. All right, we have a long list. Are there others that we have touched on, talked about, think about, Supervisor Hagan?
Thank you. I don't know if this would fall into our purview, but the the child care funds that are going to go away essentially at the beginning of next year in January, is that something that we can add to the list, or is that
It's large, that's federal money.
is that something that we can advocate through the state to get?
I'm going to
something?
defer to the legislative committee chair. Do we have tended to shy away from advocating for new federal policies or legislation, but it's your call.
Well, I would hazard a guess that that we're lobbying the Wisconsin legislature, so they're the people that can help us with what we're asking here. A letter of support or awareness to our federal representatives would be in order, I think. And we can have, we can draft one or have Paula draft one for us and send it out to our senators and our representatives. If that would, I think that would be more appropriate because we can influence, I mean, we can try to influence, but we're talking to people that control our money here locally. That's really what we're trying to do.
And I mean, you're right, it is critical. So a letter I think would be appropriate, and we'll put that on the legislative agenda in whenever we meet, October or November.
Yeah, that satisfies my concern. So yeah, absolutely.
Okay, all right. Anything else for the, yes, Dr. Hall?
So, and I confess to some ignorance here, so I am not sure exactly what all. I know there are some efforts at the state level to address shortage of healthcare providers in general. So we have shortages of physicians and nurses and CNAs and mental health providers throughout the state, but most especially in our rural areas. And of course, we here in Menominee just lost our labor and delivery services at our hospital in this past year because of inability to recruit and retain OBGYNs. And that issue with OBGYN specifically is anticipated to get even more difficult as younger people who are more newly coming out into the career are going to choose states where they can practice without worrying about certain procedures being illegal in those states. So that's anticipated to get worse. So I will confess that I am unprepared in terms of I'm not fully familiar with what the state is doing currently to try to address the healthcare workforce in our state, particularly in rural areas of our state. I know that there are some efforts afoot and some grants that have been issued, but I don't know if it's anywhere near sufficient to the task. And Katie, I don't know if I'm just calling you out of nowhere with no warning or anything. I don't know if you know anything more than I do. I don't know if this is something that we should be talking about, but yeah, it just seems like there's a shortage nationally, there's shortage in rural areas, and all indications suggest that it's going to get worse.
I know that there was at least one effort in the governor's budget in the last round. I have no idea where it went. I mean, it's not something that I had followed. I don't know.
All right, so I might try to look into that a little bit
Okay.
and see if that's something that we should try
Yeah,
to
look
argue
into
for
that and see
as
if that's
a,
something that we would feel comfortable advocating for, and we could come back to it in another meeting.
sounds good.
Okay. Anything else that others want to bring? Yes, Supervisor Hagan.
Thank you. I just have one more thing. I was wondering, are there any other state mandated statutes that don't have any revenue streams attached to them that are not included on this list yet? Like,
Lots.
I mean, to me, it seems like it'd be a good thing, a separate thing to have the list like we get at the budget committees to say, hey, here are the state statutes that you're putting on us, which is great, but they're also not funded. So can there be anything to that?
Ms. Winter?
Like
are
as an
there-
addendum?
I don't know. I mean, it's easy to say, please fund all of your unfunded mandates. I don't
Right.
know where that's gonna go.
Right, I think we're maybe better off identifying which ones. The example that I wanted to share with you is adult protection. That is a mandated
Right.
service, and the funding for that is so limited. So in my mind, it may be better to identify which ones are that Dunn County is really struggling with. Example, we're asking for another position, but
Right.
there's hardly any funding in there from the state to be able to support that. And so when we look at that, we can point to something versus just a general broad overall response, but it's your decision as a board, but. those
Well,
would
I mean,
be-
certainly the more specific, I mean, I think the more effective it would be. Yes, Supervisor Steen.
If I might offer a suggestion, perhaps we could identify the programs that are not fully funded and the percent at which they're funded and the shortfall money-wise. that we're dealing with. I think that would be helpful. It would be data driven. And so it makes its own argument.
Correct. The budget, may I
Yeah,
respond?
please, please. I'm
The
sorry.
budget that we proposed previously does have that in each section, how much funding is not supporting those programs. And so
Yep.
we certainly could take a look at that again and have that conversation of what's not being, I could try to synthesize that for
Yeah.
you. Yeah.
Supervisor Hagan.
Yeah, that sounds great. And I guess also what I'm thinking is for those mandated statutes, I don't know, after the legislative committee, what happens to these lists, but could we maybe add in the statute line at the end of these as citing our sources for these programs?
It,
Yeah,
It's
go
a little
ahead.
granular,
Supervisor
okay.
Scenes, his committee.
yes, it wouldn't hurt. And I was gonna suggest that we would, rather than, I know your reports, the information's in there, but if you give a little cheat sheet where you just list, 1, 2, 3, 4, 5% and the amount of money, and then the statute, that would get right to the point. I think would help the rest of the board members. This committee has the opportunity of reading all this stuff and hearing about it. The rest of the board doesn't.
Yeah.
So it'd be a quick snapshot for them.
I certainly can do that.
All
Thank
right,
you.
let's do that. I never really know. I mean, this goes to the legislative committee, gets approved, and then gets passed on to our legislators, and we almost always have a meeting with them in January, February, to which anybody is invited. I never know. I mean, I always have the longest list. We have a lot of things that we have been asking for and need. And I don't know if having a lengthy list is more effective than having a short list. I don't know. Yeah, Supervisor Breslin.
Well, this would be the time to have the biggest list you could come up with, because our representative happens to be the chair of the health committee now. So we've never had that opportunity.
Well, that
before.
that would be nice. Last year he didn't respond to the list, but hey, we can ask him. Try again every time. Yeah. All right. Well, we've suggested, this is not an action item, but go ahead, please, Dr. Hall.
So one of the things, when we meet and we look at our budgets every year, one of the things that strikes me as having a very chaotic impact on our funding is when we have individuals who need long-term psychiatric hospitalization. And that is a huge economic hit for the county. And it's also one of those things you can't anticipate. Somebody might be maybe they'll be in Winnebago for 10 days, and then another year, somebody's going to be there for 9 months. And it just has such an outsized impact on our budget. And so to me, it just seems like it's kind of ridiculous that the funding for those things is coming from the counties. When you have something that can be such a huge expense like that, it just makes sense to spread the risk around to the largest pool as possible. And so, I mean, I would advocate that those types of things, and it's not like we're deciding as a county, right? Like, it's not like we have a choice, right? This individual needs that level of care. So I guess I would advocate that should be state funded. That shouldn't be county funded. It plays absolute havoc on your department's budget. It's a huge line item sometimes, and then other years it's a 0 line item. So I'm just raising the question whether the state really needs to look again at who funds that particular service, because it seems like a real hardship for a lot of counties, especially those that maybe they don't do quite as good a job as your particular department is kind of anticipating the potential need for those things and budgeting them in. So it's just a question that I have.
Paula?
I appreciate that comment, and I believe that would be really helpful. Certainly, we are not able to predict that, just like
No.
you said. And on top of that, many times individuals that are in family care are placed there through family care, and then it's their responsibility to work to get them out. And we have very little voice in that. And so not only are we responsible for the ones that we're kind of managing, we're responsible for ones that other agencies are managing as well, which makes that very challenging and hard to work with our budget as well. So something like this kind of change would be so beneficial to counties.
Let's
Yeah.
do it.
Okay.
We've given you a number of assignments
Okay.
on the legislative agenda.
Yeah, may I clarify the adult protection one? Is that
Please.
something that I
Yes.
may add or?
Yeah, I thought there were head nodding.
Okay, I just wanted to make sure
Yeah,
that,
no,
Okay.
APS.
thank you. I
Yes,
will add
Supervisor
both of them.
Steen.
Well, all of these are interrelated and it's the ripple effect. When you have to have an adult placement, that not only affects the human services, but it affects the sheriff's department. It affects the
Absolutely.
judiciary, and it affects other, not just that, but other parts of the human service, and so the ripple effect is much greater than the initial money effect, I think.
Mhm. Thank you.
All right, so obviously next month, if that's a reasonable expectation, we'll look at these ads. I didn't put this on as an action item because I really didn't know how far we would be able to take it. So we can assume that by consensus, we've made a number of changes and we'll look at that and put it down as an action item for next month and get it to the legislative committee. Okay. Sorry to give you a whole bunch of extra work.
I appreciate this committee support. It's,
Okay, good.
if it means that we can advocate for the funding that we need to do our job, I appreciate that. Yes.
Absolutely. All right, ready to move on? Veteran Services. Oops.
Right, good evening, everyone. I'm going to share my screen as I start. I have a short video of an event that happened
Cool.
last Saturday, which we've been and I handed out to the group, and I'll leave this screen up for those that are viewing while I go through and describe some of our local, state, and federal activities. So I'll hopefully the video here works. And you can hear it. That's so we've been partnering 12 years now with the local 434 Pipe Fitters Union that does a good job. Hopefully that one. A little bit of delay on there. Well, here's what I'll do. I'll leave that up there just so we don't play around with the technology, but there's a link on there. It was WQOW channel 18 news.
Let's try one more time, see if you can get it up.
It says that I'm sharing it right now.
Yeah, you're sharing your screen.
But you're not sharing the video yet.
Always welcome. Always welcome.
Everybody needs tech help.
Yeah, it'd be great. So do I just need to share?
Stop share once. Okay, now go back to share. Just because I think you may have clicked on the
Okay,
share screen. And then is this the video?
it is.
Click on that. Share.
There you go.
Yeah, let's hope that the sound will come through. I apologize who's.
Oh, okay. Let's. mute your sound.
Yeah, I muted it.
Why don't you stop share again? 'Cause sometimes you have to, okay, now go back and share.
I need to.
And I think you got to share sound right here. Now click there.
This will be the last.
It's for a good cause to take care of our veterans that are out there that
Nominate you for an award
serve
for
the
county.
country, and it's time to give back.
All right.
Fire
So
starters as the weather gets cold.
a little bit of background. Thanks for the help, Paul. Save the night. Yeah. So we've been partnering the last 12 years with local 434 Pipe Fitters Union, a number of local heat HVAC companies are members of that. And so we get a request, and those of you that have been around a while, it's typically been like a November timeframe. They used to do it around Veterans Day, and then now it's been trending closer to the summer. And so we had a very short turnaround on names, but we're tracking because we know some of these events are coming. So we always kind of keep our stable full of fitting individuals so that we can provide them. So I think we probably had close to about 15 of the 15 individuals that participated. They'll talk about one veteran who is going to have a furnace entirely replaced. That is a Dunn County veteran. But I'll just kind of let you get a little bit of background. It's a great program. Furnace cleaning, furnace filters, inspection,
Wow.
and the HVAC guys very, very much appreciate. They do larger scale programs like this throughout the country, and they really narrowed it down to veterans, and we sneak in dependents because they're surviving spouses who
Sure.
doesn't need it more than them on
Sure.
a fixed income, but it's the appreciation they get in return. And so they very much want to continue that partnership. So I'll hit this.
Older, many are starting to check their furnaces. The task is taken care of already for some area veterans. That's because a group of volunteers helped around 30 veterans make sure that there were no issues in their furnaces so they can enjoy a safe and warm winter. The efforts are for Project Heats On, a national volunteer effort that gives veterans free services and repairs.
They're giving up a Saturday to come out, and they know it's for a good cause to take care of our veterans that are out there that serve the country, and it's time to give back.
The Plumbers and Steamfitters Local 434 worked with the Eau Claire and Dunn County Veteran Services to get connected to the veterans helped today. They installed clean filters, making sure no bugs were in the furnace. Some volunteers even found a crack in one that would be terminal, but that furnace will be replaced for no cost to the homeowner.
The end of this.
Awesome.
Yeah, it's a great program. We're glad that they include us in that.
Yeah.
So what I'll go back to sharing. Oops, sorry. I'll share the document that I handed out here, so the rest of those watching can follow along.
About 30 minutes north of Wabasha, or visit us online at dixrv.com.
Let's watch the news.
How's that? Okay. So just a couple other things. The fall is can be a busy time with students going back to school, and so we typically will try to do outreach, and so thankfully we had program assistant that has a couple days a week with us that went to Chippewa Valley Tech, and it was absolutely fitting because she had used a number of those benefits for herself. So that was a good event to participate in. And then also we had met with Stepping Stones or Community Connections manager, Autumn Cernhouse, I believe, named, just to kind of talk about some of the programs that they have for food. It was very very good to hear about how much goes on. We do a good job within the county, kind of partnering in amongst our own departments, but then we have our other partners that are just arm's length out that can offer so much, to kind of enhance. And the program she had talked to us about was a food delivery program. Very, very, very good. Yeah. So we're going to try to get a number of veterans that are homebound, or maybe not homebound, but should be homebound, but nobody takes their keys from them to help with that. So it was very, very, very good to get that information. So the other part on the state level, St. Croix County Veteran Service Office put on a Veterans Expo over a day and a half, and again we have we want to partner with our adjacent counties, because and it was important to me to have a presence there, at least as far as the being on our state's leadership, but also just offer if they needed to do a presentation, and their service officer has done stuff for us here when we have outreach events as well. So I did an hour training on healthcare, partnered with one of their veteran specialists in the office, and then our veteran specialist, Jessica, the following day did a training on wartime pension, which is actually the most difficult program to work on. So I was glad that she volunteered to do that one. Yeah, it was good. It was well attended. The state of Wisconsin Department of Veterans Affairs secretary was there in attendance. So and then local congressional representation, but they not in our district, so it wasn't, there really wasn't much connection, but it's just good to have that presence there. The other part, I actually run into Andrew down at the Wisconsin Counties Association, just drove down in the morning to do part of our state leadership to present at the Counties Association. The relationships are an important part for survival in any organization. And the Wisconsin Counties Association, if you have their support and their backing, it can be powerful. And so that's a relationship that we want to make sure that as an association, we continue to be present whenever available. And represent ourselves in a professional manner and be able to identify how and what we bring, because as a whole, it can dispel a lot of those misconceptions and myths if you have an opportunity to speak directly with supervisors and as well as the other county administrators throughout the state. What I emphasized during my part of it, there was our acting president, and then we had another past president that spoke, but I took probably about 15 minutes to talk about expectations, so that those in the audience had a good understanding of the expectation they should have of the office in their county, so that they will know what they should get when one of their constituents comes in that door, and that should be open to everyone, and how people should be treated, respected, and what our knowledge levels should be. And so that was important to me, because again, that the better customer service you provide, the better chance two people will come back. And if people have the correct expectations and know upfront, then that there is no further questions. They know exactly what they should expect, and you're just following along the process in this difficult bureaucracy we all work in at times. So the other, already talked about the military, over the Chippewa Valley Tech. On the federal level, it's great with the expansion of benefits that are offered to veterans and dependents, but comes with that there's always growing pains with things. And we have a continual challenge in a few different areas. And it's typically procedural or process and capacity. If you don't have enough people to do it, and then if you don't have the right people to bring that forward, you're going to have bottlenecks. And I think we're at that point right now where, just as an example, burn pit registry years ago, it was the Agent Orange registry, where veterans have an opportunity to put their name in on this registry to identify that they were exposed, and then their healthcare will be tracked, and it's supposed to create trends and produce future studies to identify that there's a large number of individuals that suffer from disease X. However, it's a great idea, but it oftentimes doesn't produce what I think it's intended for. But this burn pit registry now is so we've got local clinics referring to our office. Hey, go there; they'll help you with the burn pit registry. And it's when it's internally within the VA that they just have to go online and sign up, and so but it's a good connection, because then it'll often generate like a benefits overview, or we're able to ask some questions to do more for them. But sometimes it can give the appearance that the right hand doesn't know what the left hand is doing, and we don't want that. So we're kind of handling that right now. The other part is that a program, it's called Champ VA. Basically it's health insurance. And I know I've spent years identifying that the VA is not health insurance, the Veterans Health Administration. However, there is a program for dependents that is insurance. For the veteran has to use the VA, but if they're considered 100% disabled, permanent total, their dependents are offered health insurance. It's incredible insurance, no premium, not a high deductible plan. It's great. However, the Congress had kind of put their thumb on that program for a while because there was like a 9 to 10 month processing time to get through a couple forms. And it's already stamped that they qualify. And so they've in working on correcting that, all we can determine, because we have people that just incredible delays, but I have our program assistant calling every week with a list of about a half a dozen just to follow up, because even though everything will be retroactive, that does not stop the hospitals from sending bills.
Right.
And it doesn't stop things from going to collections. And you can tell them whatever story you want, but until you can produce a viable card, that's right. And it's taking such a long time to do that, but they're pushing things into two different lanes. And again, one is not acting on the other. And so it's basically there, it just stops right there. And so we keep calling and say, hey, talk together. And so it's been helpful, but there's no, they've got it blocked off. So you can't speak with the supervisor. So your only route to get to talk about things, you can certainly fax and you can call, but to actually get to a decision maker is difficult. So that'll be, I'll have the opportunity to speak to representative to just kind of bring some of these highlights forward.
Yeah.
See if it can be fixed, because it's just a procedural issue. And I don't know how it looks behind the scenes, but I'm sure that could be easily corrected if they're aware of it. But you can't make anybody aware of it if you can't talk to anybody. And so the last, we just continue to have, if a dependent turns 18 years old, they can still remain on a veteran's claim. If you have a 30% disability or greater, you get a few extra dollars for having your dependents, because essentially your income potential is limited because of the disability. So therefore, we can give you a little bit of extra money for your dependents. But when they turn 18, you have to send a form in. It's not a priority to process. And so there's delays in that. And then there's a break of about 3 months when they go off to college. So they turn 18 during the school year, and you have to revalidate when they head off to college. And so it's just those processing times. It's important to make sure that no debt payment is ever hit by the veteran or received by the veteran if somebody starts getting payments when they shouldn't. But it is just some incredible delays in that's just stuff I'll bring forward, hoping that somebody can correct that. My assessment of why that's happening is because things have kind of blown up with where the priority is at. And historically, when there's delays in appeals, they'll shift personnel from regular claims to address appeals so that Congress is happy. Once that gets reduced, then they push them back to the regular initial claims, because those are starting to expand out to take longer. And so they're just chasing a tail, because it's tough to keep people hired and trained. So it'll be this way, I think, for many years of doing this. But as long as we're knowledgeable about it, we can inform people what to expect, and we'll work through that. Any questions about anything I reported here with this? And I'll stop sharing my.
No, but I'm sure the other members of the committee will join me in thanking you for your leadership and stepping up with the Wisconsin Counties Association and lots of our external partners. You do an excellent job, and we appreciate the leadership.
My thank you goes out to the 1 1/3 staff I have in my office. Because it does create a strain, you know, so
Yeah, I'm
I don't
sure.
want that to go unrecognized when you have a small office, so that doesn't, yeah, that definitely happens. So I will, do I gotta turn this back to you to share the other stuff, or are we good? So I'll move on to the Veterans Served report, and there's a couple items just to draw your attention to, just to be thought provoking. If you look at the 2022, that the heading says fiscal year 2022. The other, if you compare that with 2023 and just look across the contact or records under August, you can see 1131 this year, last year 1071. And so each of those anytime somebody contacts us, we're producing forms, we're answering calls, these are notes we're making in file. This isn't something we're putting on a Post-it note and tallying. These are reports that we can run. So that just to kind of identify, it's a little, you know, it's probably about an 8.5, maybe a 9% trend. So just kind of keeping an eye on that, because that, again, in the support to just have extra body to help with some of these things for a few extra hours. I think that this kind of helps support that. The other part, I just draw your attention to look at the 2022-2023 comparison, far right bottom, retroactive payments. We started tracking this last year, and it's we're a little bit above the total last year already here at the end of August. And in the PACT Act, the new congressional items that were approved is really producing or driving some of this, because we've had some lengthy appeals, and they have to go back to pay some of these dependents because the military caused the death of their husband or wife. And so those are resulting in like $120,000 back pay. So I'm expecting that to, you know, there'll be currently we'll be able to kind of identify like expected baseline, you know, here for a while, until we track down all of those past claims that should be relooked at. But real money is kind of the point. Money that comes in, televisions, car payments, rent payments. That's
Money
real
that
money
comes
coming
in,
in.
money
Yeah.
that comes into the county.
Yeah, right. Yes, that's probably the bigger point. It's not a forecasted, it's real money that we're taking off a report and like, yep, they got it in their account.
Yep.
Any questions about that?
Excuse me, Supervisor Steen.
Yes, Greg, I see that the total pending claims is at 295 mark. It seems like that's just continuing to rise month by month, and it's over last year. Any comment on that, or a reason for that?
Yeah, what I've seen is we're probably like the average number when we're helping somebody with the disability claims, the average number it's like 5 to 8 conditions compared to when I first started 2, 3. And part of it is, you know, the expansion certainly through the years. But I think our association, we do a good job sharing and talking and educating one another, because there's many layers underneath. His example, like an incredible change is with hypertension being caused by toxic exposure.
Right.
There is not one thing that happens to us that high blood pressure does not make worse if it's not managed. So that's many layers behind under those skin that we owe it to the individuals we work with, because it's protection to their family. If we're not trying to have that stuff recognized, it could impact something that, you know, with that family, if that individual is maybe the breadwinner, is not able to work any longer. So I think that is going to continue when our active duty folks that are coming off active duty, they're running a list. I just did one, I think 15 things, you know, because you spend a 25-year hard career, multiple deployments. You've been seen for broken ankle, you know, meniscus to lumbar to blew your shoulder out from a bad jump to head injury banging it off the side of a plane to many others. So I think years ago, those weren't recognized. That was just, they're like, okay, boy, that stunk. You hit your head. That isn't the case anymore. So that long answer, but it's going to continue that way.
So if I'm understanding this correctly, you are dealing with more things that are compensable. Therefore, the judge has more things to look at that are compensable. So I don't want to defend those guys, the judges, but is it reasonable to expect that it's going to take them more time to address this than the simpler ones?
Excellent critical thinking. Yes, you are absolutely right. Yes, that is absolutely true, because there is so much more to look at. Yeah.
Follow up to that, then I think if I recall right, there's a fair amount of turnover on your judges, or there was. Therefore, there's a learning curve for the new guys that come in, or new people.
Mm-hmm.
Do you see that continuing, or do you see any as they get more? My experience with you is that in some cases you know more than the judges, so therefore, is that going to improve?
Of course. I mean, because they're hiring more people. Experience, you can't put a price tag on experience. You know, that's and they're bringing in new people that are going to do, some are going to do an incredible job, and some are going to have a little bit longer learning curve, but they're all bright. I mean, and you have everything at your fingertips. You know, you just have to start your computer up.
Thank you, Greg.
Yeah.
I appreciate it.
Yep. I almost blew right past the two impact statements. The first one, to basically, again, another overview of start to finish on a great success of opportunities being available for somebody that is hit with some challenges, and through getting involved in some programs when things are hard, and using those to your benefit to improve your well-being and livelihood, and just to see the individual put the work in. I think you look at the time, 6 to 7 years to full-time taxpayer, educated in a professional role. And I think that's just a testament that that the federal government is taking care of people. You know, I'll give them definite props for the fact that they have these programs, and when individuals use them, these great outcomes, and then therefore they'll be much better off in life. The other situation is much of what I talked about, is those as a result of the new legislation. You know, things go through, we're trying to dig through death certificates and files to see, so we don't miss anybody. Again, that's a kind of on the side thing to look through that. But again, just another situation of looking through, finding that something should be considered and found through, and good outcome on that. Any questions regarding what I've went over so far?
Any questions for Greg? Supervisor Hagan?
More of a clarification to the point we were talking about earlier with retroactive payments and the story, the last one.
Mhm.
So we see the jump in retroactive payments this year in August. And is that your story number 2 folded into those numbers?
My assumption is that is part of August's payment.
Yes, not the
Yes.
whole thing, but
Yeah, that's got to be the month. It's not last year.
So we can see the numbers in real time right here with this story to the retroactive payments to the county.
Yep. All right, I'll hit the financials. this is through the end of August.
I
I'll
will.
start on the first page. And first page, again, if you look at the key parentheses, don't necessarily mean negative on the
We're
summary
okay.
page. Okay.
We got it.
Okay, all right. So as you can see, we're sitting at about 86,441 remaining in the budget for these last few months. I'll kind of just address, if we look at the actuals, if we go into the second page under the I'll call it ends, the last
Sorry.
two digits is 110. That's more our operating as our salary and fringe
Mhm.
operating costs. And I'll just address a couple of the negatives that are the true negatives. We have a little bit of overtime on this. That will not be a problem because I'll be able to use our veteran service officer grant to cover that. There was no overtime that was on this budget. Past years, there has been a little bit of overtime, but they adjust it based upon trends. We try not to have overtime. We try to use comp time instead. And then I will also go down and address under the operating expenses, travel reimbursed again. Like my $190 negative is another program's like $15,000. So, but I have to give that much attention, just so you're aware of that. I'm aware of how small budget is, but I still feel obligated to address the negatives. Sometimes cars aren't available.
Yeah.
That's it. They're signed out. So we've got to throw mileage on there. It ends up being expensive, but I'd only budget about $75. I intend to always use a county car. So that's basically to discuss that. And so under our veterans relief on the second to last page, or page 3 of 4, we're in good shape with that. A little over 6,000 left. Don't anticipate any major changes. We've transportation costs are not going to skyrocket. Things are trending just in a way that more local care, which reduces those costs. And we've been using gas cards as a simpler method, and county has a very, very diligent gift card tracking system that has to be submitted monthly. So everything's on tight rope on that. So and I don't anticipate any issues with veterans relief. We will purchase some flags at the end of the year, so there'll be a larger cost. But again, I'll address that later. The veteran service officer grant, look down the updated budget. It shows 26,878. Usually it's 11,000. We got some of that ARPA money that's in there. There's some salary and attendance hours. Attendance hours are for hourly staff, salaries for myself. And we're tracking that because we have to keep the hours within the range of what we've had approved. So I don't anticipate any problems or any issues with that. I was planning on carrying forward about $4,000, but I planted the seed today with the boss that, hey, if things go well with the budget process, I'm going to burn that up, asked to burn it up this year. So
Okay.
planted that seed today. Any questions about the budget?
I had thought this earlier, but was advised by Supervisor Steen that it would be a really good idea. If you would be willing to draft a letter to the union, the pipe fitters union, I would be happy to, a thank you letter. I would be happy to sign it on behalf of the Dunn County Health and Human Services Board. It seems like a nice thing to acknowledge what they've done for our veterans. If you'd be willing to do that, I'll zip in and sign.
Yeah, it's a great idea. I'll write it down so I get it done.
So you remember.
Yes.
Yeah, you
because
write it down because
is-
I might not remember.
it's-
I might not remember.
Yeah, not that this is part of the report, but the things that we should do the most of, we often don't do them enough. And that's exactly what
Thank yous are one of those things. I
Yeah,
think.
this is
Yeah.
one of those things. They're a great partner. I'll get it done and shoot you an email.
All
Thank
right, great. That's great. All right, moving along, unless there are questions or observations for Greg. All right, moving on to public health. Kitty, it's in your court this time.
All right, good evening. So in the packet, you have our regular update for the health department. So quite a bit of information in there. Excuse me. I did want to lift up that our WIC director did give quite a summary on impacts to the current federal budget situation impacting the
Yeah.
program for your awareness. And then I'm going to share my screen. I gave you guys a handout on kind of our overview on demographics. It is tiny. But I do want to pull that up so you guys can see it real quick on the big screen. All right, so let me just, hide you. Come on, friend. Where's the hide?
And
Okay.
so while we're waiting for that, right, what I heard on NPR the other day was that, the WIC funding is, if there's a partial shutdown, it runs out within days,
Yes.
and then people don't have access to those benefits, those nutrition benefits.
So we are waiting to see how it's absolutely going to come down. I do understand that sometimes there is a float within different states as far as what they have budgeted and what they can dole out. And then there's potential for a float within the county. So we do need to be really aware of what is going to come through and what we have been allocated for this year, since we're at that time frame. But it is significant.
Yeah.
All right, sorry about that, guys. All right, so this you guys have in front of you. It is itty bitty tiny because it's all on one page, but I did want to pull it up so you guys could see this. So we just closed our community health assessment. You'll see different preliminary demographics out in front. We, of the 3 counties, we did have the highest return rate as a percentage of the population. I would share that many of the same things that we have seen in the past, we saw again, as far as an oversampling of folks that have higher educational attainment, higher resourced, and then of course, middle age and older tend to be our respondents oftentimes. But what I'm really excited to see is that we do have representation from all demographic age groups. We did a hard push over at Stout to get some folks between 18 and 24. That took a little bit of doing, and I'm grateful for our partners over at UW Stout. But then also just being where families were. And so getting some surveys out to our playgroup families, getting some surveys out through our WIC families, just to make sure that we have a good representation of people in the household and then age demographic as well. Wanted to share that when we look at racial distribution, we did a really, I would say, a fantastic job making sure that our Hmong community was well represented in the responses here, as well as, again, having some representation from the different racial groups that we would expect to have in Dunn County. So happy to see that. And then something I thought that was kind of fun, you just never know how people are going to answer things. Looking at that distribution on second language, people have a great sense of humor, right? Yeah, so any questions on a quick demographic scan?
Interesting.
So not a question, but a comment and a thank you. So I really appreciated how on so many of the bar graphs, you said these are the percentages that we got for survey respondents. And then you showed us what the county distribution is, which really gave us an idea of, in what ways did we represent the county well? And in what ways are we maybe underrepresented? So I know that was a lot of extra work to put in the county values for all of those, but it was such a great comparator to have. So just thank you.
So this is part of us working in concert with Eau Claire and Chippewa counties. I didn't do this. There is a project manager who's working with the Eau Claire City County Health Department who was able to pull this together for us.
No matter, well done.
Okay, so that's our update on the community health assessment. I also wanted to lift up, just in case you guys are seeing questions or hearing questions about the different respiratory illness vaccination campaigns that are moving out there. So the Dunn County Health Department will have no private pay vaccine for COVID-19. We will continue to have state provided vaccine for children through our Vaccine for Children program. So those folks have a couple different criteria they can make, most notably being Badger Care eligible. We will also participate in the Bridge Access program, which is basically for uninsured and underinsured adults under 65. Again, a small amount of COVID vaccine for that population. Other than that, we are encouraging people to connect with their provider or one of the large or small pharmacies that are carrying that in our community. It is available now. We are also encouraging folks to get their flu shot. So we are providing flu shots, of course, to folks that walk in. We're able to take a lot of different insurances for that. And we did just put a push out this morning through the administrator's office about special walk-in times for folks and their families for Dunn County. And then finally, something that's really exciting is RSV and the different protections available to older adults and pregnant people. And so there was just a new vaccine meant to provide immunity for the unborn child by vaccinating that pregnant person in the last trimester, 24 to 36 weeks gestation. So I'm glad to see all of those things. We will, as a VFC, Vaccine for Children provider, have some access to the monoclonal antibody for infants, but we're still trying to see how that rolls out because that's not something we have ever done before. So it'll be exciting. So I just wanted to lift that up for you guys just in case you are seeing questions. We'll talk more about environmental health. There's a lot of good updates in here about environmental health. One of the things I did want to lift up is that in the inspector report, they do the newsletter. One of the things the state's doing is putting all inspections online. It used to be that you had to opt in or in order to get those online. Moving forward, they should all be listed. The link is broken. I tried today. It should have gone live on the 24th. So I will give you guys an update on when we know.
This is not a good technology day, obviously.
It's not our technology, it's DACAP's technology, but nonetheless, if you went to go look up your favorite restaurant in Dunn County, you will not see that report.
And by the way, in your update, you should thank Derek from us for doing such a nice job this summer, particularly helping with the water testing and all.
Yes, I think that sometimes you have some fantastic interns and sometimes you don't. We really lucked out with a fantastic intern. And then you guys saw in the report that he was able to parlay that experience into a full-time position with the state of Wisconsin DHS. So again, when we can foster and develop new public health professionals, we're doing our job. So it's good.
Yep.
But thank you for that. Any questions on updates? Oh, I'm sorry. One more thing. Let me pull up I promised you guys that I would come back to the table with an update on our reproductive health clinic and the logo. So you guys have that in the handouts that I gave you today. You can kind of read through the why behind things. Multitasking poorly.
Can I see that? Yeah.
Okay. So just making that a little bit bigger. So we have rebranded the reproductive health clinic based on the feedback. You guys already saw that report. We did some internal work and then put it out to our community partners on what and why. And so and then we heavily favored the feedback that we got from actual participants. So we landed on the logo that takes a little bit of the health department's logo, so it looks familiar. has some neutral colors, but colors that work with the health department greens, which I love, but not everybody's a big fan of lime green. So we did land on that middle logo with kind of the leaves and then also the medical cross. We removed the word department since that was such a challenging word, and then just really focused on the fact that it is a clinic. So we have a press release that'll go out probably early next week, and we will kind of give some of the feedback on the rebranding, but then also help lift up the different services that you can get at the reproductive health clinic. You know, access to STI testing, as well as being able to make your own pregnancy plans on when you want to become pregnant, and working with our public health nurses and our nurse practitioners. Any questions on that?
It's nice.
I don't have a question. I just wanted to say it looks really awesome, and I think using the word clinic instead of department will put a different spin on it for people's minds.
Thank you for that comment. I appreciate it.
Hillary.
Oh, sorry.
All right. Okay, so that's the end of my report before we get into the update on the water lab. Any questions on the health department report?
Any questions for KT? All right, go ahead, please.
Good deal. So in your packet, you'll see a summary page, because 13 pages is a lot. So if you just had a little bit of time, there's a single page on the summary that's Jeff's voice. I'm sure you can tell it's very different than the following several pages. But it just lifts up, when we spoke about public health ARPA dollars moving from response to recovery, this was one of the things that is squarely within the scope of work for the grant, is infrastructure around water safety. And we're looking to, with this report, was it feasible? We didn't want to move forward and spend the money if we didn't think that we could be cost neutral or bring in funding to offset other costs. And so Derek did a gorgeous job, really did a lot of research, spent a lot of time with the other health departments that are running a parallel lab. We are predominantly in the Western region because we have that struggle. We can't get things to the state lab of hygiene in time to be tested. There have been some other challenges with our local lab, again, having that either staffing issues or other issues that made it so that we would drop off water samples and they wouldn't be ran in time. So those two things in comedy, we end with the ability to make this cost neutral or bring in revenue. We wanted to put this in front of you and let you know that we are moving forward as we had discussed before. And we think that it will provide better service to our Dunn County residents that want to test their personal well every year to make sure that they know what they're drinking. But also our TNCs were required to have water testing. We can do that in-house instead of having the challenges around sending it to the state lab. And then there's some very preliminary conversations about, can we provide this service at a reduced rate to some of the other counties that have the same issue but don't have their own lab, so that we can make sure that we have a volume that keeps us competitive and, you know, of course, provides that service for folks to walk in and walk out with results. Any questions on that?
Any questions for KT on this? I thought that the analysis was extremely well done. So thank you for that.
Absolutely. Okay, so without any questions on that, I have two things as far as financials go. I think if I look at the agenda, are we doing the year to date first?
Yes, please.
All right, so year to date first. You'll see that we do have, we're still continuing to trend to the positive, that we're in good shape there. And I am, again, continuing to work with finance to make sure that we are accurately representing both our expected revenues from grants and our costs. We are continuing to have some challenges and find the rough edges in processes around getting people assigned to their proper grants. And so, for example, our intern, was a really challenging situation in that AHEC, or an external organization, paid for their first 300 hours. We paid for their second 300 hours using a grant, but that went to a public health admin. So we're still trying to and they finished their internship last couple weeks ago. So we're still trying to work through the rough edges of finance, HR, and SAP. But we are on
We'll
track.
change it.
We are on track. So again, I think it's 30 some to the good, 36 to the good. Any questions on that?
Any question on the current finances for public health? Hearing none.
Okay. So the other thing that I got you in the packet is an update or a draft version of our budget, because last time I was here, I was caught a little unawares of some of the numbers because they were not the numbers that I had put together, because it is moving and we have changes to some of the things that are above my pay grade, and that was reflected in the document that you saw. What finance and I were able to do in the second version is put people back where they belong, associated to grants instead of to levy. We had a couple folks that had unfortunately been relocated inappropriately, and so we got them back where they belonged. But then we were also able to take this opportunity to show some grant dollars that we knew we were getting, and we had award notices but weren't reflected in the previous iteration. So Nurse Family Partnership, we have a increase in Family Foundation dollars for this year, and so that's reflected. And then the consortia, so the 3-county consortia with Nurse Family Partnership did win a competitive grant from Roots and Wings. So that Wisconsin-based foundation is the charitable arm of the folks that developed EPIC, the electronic medical record system. And so we were able to reflect those dollars as well in the grant. So that was really helpful. And I would love to get you guys a grant, or I'm sorry, a graph for that grant funding to levy funding over years. You guys will remember 5 years ago when I started, this was predominantly, other than a very small, it was from a grant from the Community Foundation, levy funded, and now we've moved to substantially grant funded. And then a couple of the other things that are reflected in this version that were reflected on previous versions are some of our substantial IT costs, where we had IT costs for quite a few of contact tracers that no longer have IT costs, including phones and laptops and other items that made that really challenging. And so we were able to clean that up a little bit, got back to where I knew that we needed to be. And so that's what's in front of you today. Any questions on the roll up? It's still showing a negative balance of $30,000 for the year, but you guys will remember what was in front of you was 115. And so a lot closer to the realm of where I think we are. Again, having some, working to get our revenues back to pre-COVID levels, but then having a real reduction in our staff because of our role in COVID winding down, and having that all reflected still here.
Yeah, I think this budget looks a lot better than what we looked at last month. So yeah, thank you for this.
All right, that concludes my report.
Anything else? Any questions on the 2024 proposed or anything?
All right, thank you.
All right, well done. Thank you very much. Department of Human Services is up next. This winter.
Thank you. You mentioned earlier that we don't do enough thank yous. And so I want to start off with 2 huge shout outs. First of all, KT's staff came and met with our all staff meeting today and talked about bed bugs, which was a little creepy, but it was also a lot of really great information and very helpful, not only for the common person that might be traveling or visiting other places, hotels, all of those kinds of things to get that information, but many of our staff are out in the community and traveling for trainings or those things, but also out in houses and, just could pick up bed bugs really easy and bringing them back home to their own families. And the cost of, trying to remove bed bugs from your home is really high. And so that impact that it might have on our employees. And so they did a great job talking about what to look for, what they look like, what we can do to try to prevent bringing them back with us, all kinds of stuff. So it was just a really great presentation. So I thank KT and her team for that. I also want to give a huge shout out to Greg and the team there at Veterans Services. Comment that was made to me yesterday as I met with an outside provider who had to wait about 10 minutes because he was a little bit early for the meeting. And he came in and he said, I learned a lot by sitting in your waiting room. He said, there's a lot of medical equipment that's coming in and out of the government center. He said, I was amazed. I didn't even know you had that. It was just like continual in and out as I was sitting here. And I just thought it's like a little treasure, a little jewel that maybe a lot of people don't know, but it really is active. And it's just a gift to the community to have that. And so a big
Yeah,
shout out
sure.
to veterans as well. With
Well
that,
done.
yeah, with that said, I'm going to jump into my report. We do have Becky that's going to present tonight on her duties as a deputy director. So I'm going to try to keep this short with my portion of this. I did have my director's report in your packet. There was several grants that we received, which was exciting, and even some fun things like dog food to people in the home delivered meal participants, which I thought was pretty great. We had, again, the results of the audit. They were able to bring back some additional pieces to that the auditors had missed. And so, you know, being down to that small amount of $621 that we had as an OBAC is just phenomenal, and just speaks to the staff that are working that program and, you know, just that amazing job. The one piece I really want to highlight is the trend that's going on right now in our Family and Children's Service Unit. We have had a large number of resignations, as you could see from my report. Some going to the private sector, some going to different types of clientele. So working with older persons, working with persons with disabilities. And then we've had a couple that actually transferred into our mental health and substance abuse units. So with that unit, it's, you know, we see some trends. We see people that are beginning their career going into child protection because that's a lot of times where the vacancies are. And then they get in it and go, wow, I'm not made for this. This is really tough stuff. It's hard to sleep at night, all of those kinds of things. And, you know, from what they see and experience and the trauma that's all involved in everything that they do. And so they, you know, pretty quickly make that move. And that's, you know, when we're seeing some people with that change into different populations of social work. And we also have a trend of people that have been in the field for multiple years and they just become wore out from it. They have a lot of passion and worked hard in the field. But it's tiring work. They're on call at night and weekends, you know, along with during the day. A lot of times they're working late hours because, you know, we don't just get safety things and it happens between 8 to 4:30. So they're out working with families, placing children, all of those kinds of things. And after a while, it can be very challenging. And we also see turnover at different seasons of life, right? So I might have children the same ages that I'm investigating. It's really hard to take them into placement, or really hard to see the things that are happening to children. And I go home then at night and look at my own children. So there's just a lot of dynamics that go into this position, and you know, kind of why people are in it and how they become resilient in it or not, and the supports that we have for them. And we can always do better in those supports. We've learned over time that, you know, the trauma that it does create for staff with doing those different things, and just how do we support them. And like I said, we can always do better and should be doing better, you know, at times. And so really looking at that, I evaluated this and made a decision to do stay interviews with each employee, as I mentioned. And so I had about 20 hours of interviews with staff individually. I have just a couple left. One went on maternity leave, so I'm not going to go to her house and do it, but I'll catch her when she comes back, right? So there's a couple that I still have to meet with yet, but then my plan is to pull all of that together and put together summary and really work with not only the unit of what can we do with this, but also HR, because there's some recommendations for there and with the county manager, those types of things, to be able to really look at what those dynamics are and maybe make some recommendations out of that.
Yeah,
that we'd be able
if
to-
I may, I wondered when I read this, if there are salary and benefit and other sort of HR related or policy related things that you might discover that need to be passed along.
There are certainly, and
Okay.
that's why I'm going to include, HR and the county
Absolutely.
manager. And if there's things that I feel like that would benefit you in knowing in this piece of it, I certainly will be sharing those areas or recommendations. So just wanted you to know, because when there is the type of turnover that is happening in this unit, it kind of then falls to everybody that's left, and they may already be exhausted from some of the work that they're doing, and then it's added cases. And in addition to added cases, they're training so many new staff, and it's very challenging in child protection to recruit seasoned staff.
Mhm.
And so what we're getting is, young adults out of college, which is wonderful that, you're getting fresh, excited, passionate people that are just graduating, but it's about 2 years of training, solid training for that before they're, really independently making decisions. And, still then a lot of hand holding after that, but, doing pretty well at the 2-year mark. So it's a lot of weight on the staff and the managers that are there. So I just really wanted you to be aware of what's kind of going on in that unit and the experience there. And from that, I'm going to hand it over to Becky to do her piece.
Thank you, Paula. Becky. Your microphone is not on. Oh, so what did we learn last week? That you have to push it down? Yay.
Can you hear me now?
Yes.
Thank you. That's a great tip. I'll try to remember it for next month.
It's a IT trick.
Yes. I wanted to talk to you all a little bit about my role and how my role, there are portions of it that are the same as when Dale was here, and there are other portions of it that are very different. So I wanted to just go through what some of those differences and similarities are, so you would have a better understanding of what it is I'm attempting to do. So as a new deputy director, some of the things that have stayed the same that Dale was doing is that I am the manager of the Birth to 3 team. And that is truly the most delightful portion of my job. Absolutely love that part. And that team has now grown to be a team of 8. I am also managing the grants associated with the Birth to 3 team, as Dale was doing. I am also the client rights specialist, so I get the privilege of taking phone calls from those people who have some concerns they'd like to talk through. So learning a lot about our public and what their wishes are and how best to address those. And I am also the contract and MOU administrator, which also Dale was doing. So managing all of the contracts that we have coming in, and then of course passing them along to Paula to get her approval and her input. Any questions on that first part?
Questions for Becky? Okay.
All right. So the parts that are new is that I am meeting with Paula and we are talking about what our strategic plan is and what it is going to be. We are mapping out what my role will look like over the next 5 years, which I have never had the privilege to do in any job I've ever had. So that is extremely helpful to see it all written out and then to chunk it out depending on what month or keep us on track. So that has been very exciting. I get to plan and facilitate some of our management retreats. So we just had one and talked about a lot of trust and excellence and things that we are striving to get towards. I'm developing an orientation plan for all new hires for every position by the month. For example, month 1, these are the things that whoever your manager is or whoever is going to be training you will be doing. Month 2, you should be doing this, and so on. So mapping that all out. Right now we're on month 3, so it's in my office if you want to come see it on my wall. I'm also leading an organizational effectiveness project, so that will be starting next week, and that will be with our APS team and our crisis team. So merging those two teams together. So we will be walking through what that process is going to look like. Paula and I have also talked about an SOS squad, which we haven't been able to start yet, but it's important to write down what you want to be working on and get there. So what that means is talking about what open positions are, and if we have the funding and the percentages and all of the data that we need in order to push those openings forward, or if we need to wait. So trying to get like a process written out so that we know when staff come to us and say, we need a new staff, we can determine if that is a true need or not. So that's something we're working on. We're also working on developing a space crew because of all of the new hires that we have.
No room.
Yeah, we are always in a state of moving everybody in. Right now, we do have one office. I believe we have 4, maybe even 5 staff in it. So we're trying to make the best of all of the possibilities. So we do need a space crew. And then we're also talking about an OOBS squad, and that's something from my old work, and that's called an out of the box squad. So thinking, how do you think a little bit differently in order to address a certain issue? So all kinds of issues that we can think a little bit differently on. So those are just some of the things that we're working on and that we will be getting into motion. Also new is that, as we have talked about here, we have many newly hired people on our teams. So I am meeting with new hires and meeting with all of the managers and doing one-to-one meetings with them to just gain a better understanding of what their roles are. I'm shadowing them, and I'm also attending their team meetings, not all of them, but trying to get them on a rotation basis in my calendar so that I can become more acquainted with what it is they do on a daily basis. And I'm also attending and engaging in board meetings like we're doing right here. So I'm very happy to be a part of this. And this is the best way that I learn is by doing. So thank you for letting me be a part of that. And then also being a part of reoccurring meetings that Paula has with HR so that I can hear things that are happening in real time. So those are some of the new things that I'm doing. I'm also working with UW Stout. I was just there today for their career fair, so that was super fun. I love doing those things, and I was trying my best to grab all the new talent and tell them about our openings. So meeting with them, I also met with the Stout Volk Rehab Institute, which is one of my previous employers where I was the director of services there, and we talked about some training needs. I have met with UW Stout Educational Pathways and Outreach. That's a mouthful, but that's what they call themselves, and talked about some training that they might be working on for our management team and our overall team, and how we qualify for a grant project so that it's going to be a much reduced rate. So that's exciting stuff. Meeting with them next week again to confirm that. And then also talking to them about how they have an early childhood conference that I used to attend back in the day. So trying to get our Birth to 3 team more integrated with what is right in our backyard that we should be taking part in. We don't need to travel across the world to go to high quality conferences. I'm also meeting with the Chamber of Commerce for their business after hours events. And that's just very simply building those business relationships with all the business people in our area. And it's just a social atmosphere. It's very difficult for me to do those types of things because I'm not very social, and I really don't enjoy that.
And you don't bring the chocolate fountain or anything?
No. So I'm forcing myself to do those things. But it's a great opportunity, and it's free, and they feed you, and you get to see people that you know from previous jobs, and it's a good time. It's only once a month. So been very active in that. And because of that, I was able to reconnect with some previous organizations like Goodwill, and they did come and talk to our all staff about some of the services that they provide in the area. Have also met with Hope Gospel, and they will also be coming and talking to our all staff, I think in November. And also I've been doing a lot of collaboration with different MCOs, because that's what my previous job right before this one was with Inclusa, a managed care organization. Sorry, I hate it when people use abbreviations and they don't explain. So meeting with them, talking with them about how their role can mesh with our role, and who's supposed to be staying in their lanes and when you're not supposed to be, and how better to work with them together. And then also just wrote an MOU for Head Start for their playgroup, and you see the benefits of that right next door. So that will definitely impact our community, and I'm looking forward to that becoming a lot larger than it already is.
Good.
And then lastly, I'm doing a lot of shadowing this woman next to me. So attending a lot of her meetings, and she does have a director meeting that I've also been able to be a part of. And again, that's how I'm learning, is being right in it in real time. Being allowed into the budget meetings and being a part of that, and just seeing how that all unfolds. I think the first budget meeting was probably my first week and I was completely lost, but it's slowly starting to make a little bit more sense. So appreciate being a part of that, and really wanting to learn her role so I truly can be a support. So should she want to take a vacation or,
No.
leave me alone, I could handle for a day or two on my own. And the last thing that I'm doing that I'm hopeful is making a big impact is that I am almost always in the office. Again, I'm social, so I like that kind of thing. But I also find that that's where the biggest relationship builder can happen, is if I'm right in your office and talking with you. And because the team is so large, and because there's so many of them, and my role is very different than what they're used to, I have found that that has been a great effort. I did ask the Birth to 3 team to start meeting weekly in person, and I thought I would maybe get a little bit of resistance, and they've all come and loved it. So it's there, and it's definitely making an impact. So I thank you for letting me talk about some of the things that I'm doing, and certainly enjoying month 4.
Oh, well thought through, both of you. Thank you, Becky, for sharing this. Any questions or observations for Becky or Paula? All right, thanks. Well done.
Yeah. And it has been a great joy to have Becky here. It feels like it's been a lot longer, just
I know it
because
kinda
she's
does.
jumped in and been part of so many things and learning so fast. So it's always a surprise when she says to me, it's only been this long. So it's been great with her. I then want to update the financial report for you. Our year-to-date report was in your packet, and that is that we are to the good for $542,933 estimated by the end of this year. So that is in a really good, solid place as we look at that. Any questions on that report? Okay. Then I also want to touch base on the 2024 budget and give you an update of changes since last month when I was here and talked about that budget as well. At that time, the numbers in the budget for salary and benefits, we had calculated 4% because that was our direction at that point of a cost of living increase of 4%. And then since that time, it was decided that it would go down to 2%. As it would be presented, in the next meetings. And so that was calculated in the budget that is now what we call round 2, is backing that down by 2%. In addition, I wanted to make sure I explain a little bit about finance and how that impacts our department. So when Beata, the CFO, talks about her new positions or adding on to the positions in her unit, one of the positions she's talking about is creating one of the financial staff positions that currently works with human services into a manager position. So with that increase of the difference between, where that person could currently is and into that management position, because it's human service duties, that expense comes back into our budget, just so that you kind of understand how that is, because it's centralized finance. So when I met with Beata, last Thursday, maybe it was a week ago, she has continued to reevaluate that position and feels strongly with looking at it that our department needs additional finance time just because of some of the projects we have. We keep increasing grants. We keep, there's just more complication to things. And so she feels really strongly that that position should be 85% instead of 50% human services at that higher management level. She does need it to have some other duties from other areas, because as those of you that were at the county board meeting last week, was it? What time goes?
Yeah.
The auditors gave that report about internal controls and such that talked about needing to have different people do different duties so that the same people aren't touching things. So that other percentage of time would be able to assist the county with some of those other internal control type things. So what she did with that then is to increase that to 85%. So that of course then increase the cost to our budget. That makes sense. And I support that if we have the funding to do that, because we definitely have financial, needs with that. And then secondly, the administrative committee spoke not today, but last month about a possibility of looking at our positions, because I had two requests in front of them, that one of them might be a half-year or mid-year start date, so that it would help save some dollars in that year or in 2024. I met with my staff, I met with the county manager, and really talked about if we were to do that, which position, because they're both critical, right? And so how do we do this? What should I propose if that's the case? We talked about that adult protection is a mandated service, and that, it's just critical to be able to get out there in a timely fashion. Sometimes it's life-threatening type situations that they're in. And so with that, I requested the Beata put that one in as a full year request. And then, the mental health therapist clinical piece, certainly our community needs, our child protection unit needs that clinical assistance for families. It will help in a lot of ways of placements and reunification and all of those kinds of things. But if I had to choose one, I had to put this one on the July 1st.
Same thing.
On the July 1st timeframe. So that is what I did. And that's what you would see if you would look at the full budget now. And so with that, the summary of making some of those changes, adjustments, we are currently at a negative $837,965. So there was some positives to the budget because of the difference in wage calculations and moving that half of a year. And then there was some additional subtractions because of the increase in the financial manager position. Any questions on that? Thank you.
All right. Thank you for that update. Like to see both of those positions go forward, but hey, whatever. We have two items to deal with. We have our normal August DHS vouchers. The amount this month is $513.70. Again, just a reminder, this is our our checkbook. So I will need a motion to note review of the August DHS vouchers. Supervisor Steen, is there a second? Supervisor Robinson, thank you very much. Any questions, any discussion? All right, all in favor?
Aye.
Aye. Any opposed? All right, the vouchers are noted. And we have a budget adjustment. Here. Let me look. It's all right. It's $151,000. Again, these are pretty routine. These are grants. And I'm sorry, Paula, I saw your face, yeah.
I just was looking at the agenda and it isn't posted on there.
You know what?
It's in the packet, but it's not.
It's in the packet and I know you did it. Well, that's my mistake.
No, it's not yours. It's ours. We should have got it posted on there. I apologize.
Can we still do it in October and get it on the omnibus end of the year list?
Yes, yes.
I guess we got to do that.
My
All right.
my apologies for
Well,
having
my
it on the
apologies.
agenda.
I should check the agenda more carefully and I sometimes do not. All right. In that case, our business is concluded. Any announcements? Comments, suggestions? All right, thank you very much. And without objection, we are adjourned.
Thank you.
Thank you all.